There's much current talk about the Affordable Care Act, and many myths abound as well. Some of these myths and misperceptions pertains to how it affects seniors. Here to simplify and clarify what the Affordable Care Act means for seniors is John B. Clark, President and CEO of Council on Aging in West Florida. Thank you for being here.
My pleasure.
Well, I know this is kicked in, so let's talk about what this actually means and when it took effect and all that good stuff.
Well, first of all, I'm going to clarify that I'm not an expert on this. An expert is somebody with a briefcase 50 miles from home, and I am neither. But technically, it kicked in March of 2010 when the president signed it into law. That's when it went into effect. But the huge changes for the law are going into effect this month, January 1st. I mean, and those have to do with the fact that insurance plans can no longer discriminate based on pre-existing conditions. There's guaranteed issue. The fact that everybody beginning in January has to have an individual policy if they're not working for a company that has insurance. So the really huge parts of the law kicked in this month, January 1st.
Well, I know there's a lot of pieces to it, and you're right. It's very hard for anyone to be the expert on all of it. But let's try to talk a little bit more specifically for seniors. Okay. For example, people that are on Medicare, do they need to do anything?
No, and that's a good point and a very important point to know. You know, and a real simple answer is anybody who's getting Medicare Part A, Part B, Part D, or maybe he's on Medicare Advantage Plan Part C, they do not have to do a thing except choose their plan during that open period, which is already passed. But no, there's no effect on somebody who's getting Medicare. There are some changes, and there will be some positive things that have occurred and that will be occurring over the next coming years, but no major effect that they will have to change or do anything.
On themselves.
On themselves, right.
Well, what may be some of the changes coming to Medicare?
Well, one of the big things, of course, is the donut hole. When Medicare Part D was enacted into law under President Bush, I think it was Bush II, actually, yes, and they created this plan, which is a little strange how it works, but if you have to get an insurance plan, Medicare Part D, and you select which plan you want based on the prescriptions you're taking, and you have to meet a $310 deductible for that plan, for any plan that you have, and then you pay like for first $2,400, I'm not sure what it is, until you reach that limit, and then there's what they call a gap until you get up to about $4,300, and then that's when the catastrophic cuts in. So there's a gap there, and for some reason it's called a donut hole. I have no earthly idea why they come up with a donut hole. But what this law is going to do, it's going to gradually close that donut hole until the year 2020, when then, during that period of time, all you will have to pay will be 20 or 25% of your prescriptions, whether they're brand name or generic. And that'll be a huge benefit to a lot of seniors, because that gap can be a real problem for a lot of moderate to low-income seniors.
Yeah, that's great news, because I've heard people being very concerned about
exactly.
The amount of money that falls in there. Well, what about insurance premiums? I mean, I know there's lots of different conditions, but directly connected to the Affordable Care Act, will there be any increase in premiums?
No, not to know. There are going to be some increases in Medicare taxes that individuals pay. There'll be small increases. However, those increases are going to only affect, I think it's 5% of the total population, the very high income earners. The average person making $50,000, $60,000, $70,000 is not going to notice any change in those taxes, Medicare taxes they've been paying. The premiums have been going up, as anybody's on Medicare knows, every year, but that's not part of the Affordable Care Act. Those have been going up anyway and will continue to go up, I'm sure.
What are some other things that you think are positive about the Act for people in this demographic group?
A lot of the things with the screening, with free flu shots, colonoscopies now are covered. There's a lot of preventive issues that are covered. A wellness visit to your doctor every year will be covered. So those are positive things. Preventive medicine is, of course, better than treating an illness after you've had an illness.
Mm-hmm. Well, if someone has questions, what kind of resources are available to answer some of these specifically senior questions?
Well, if anybody's watching has a computer, the best thing to do would be to go to the Medicare site, which is medicare.gov, medicare.gov, and there's a frequently asked questions section, which could help. It's a big help to people. or they can call our office, and we'll be glad to talk to them and tell them where that they can go to get those answers that they need.
And thank you for also working with Josh Newby at Ballinger on an article for our winter issue of Coming of Age magazine.
Absolutely.
And that entire article is also available on our website.
Right.
So that's something that they can look for. Well, let's go back to like the impact. What are some of the myths out there about the impact that are just really not true?
Well, the big myth, if you remember, in fact, it occurred during the last presidential election, was one side would say that $700 billion was being cut out of Medicare. Well, that's not really true. What happened was the government was going to reduce the amount of reimbursement that hospitals would get, that some home health agencies would receive, and so forth. This had nothing whatsoever to do with any program or service that a Medicare recipient would receive. They would still get their care. It would not affect them whatsoever. It would also, there was also going to be some changes and reductions in the Medicare Advantage plans. For those who don't know, that's Part C of Medicare, and those are plans that are run by usually private HMOs, and you can elect during the open period to select one of Medicare Advantage plan. And depending on what your situation is, that might be a great deal for you, but there are going to be some reductions in the Medicare Advantage plans too. But the $700-something billion reduction is not going to come out of the pocket of elders, and it's not going to cut into their services they're getting through Medicare.
Okay, so people should be able to go to the same doctor?
Yes, they should be able to. I mean, the truth is, you hear a lot about. I've been in this business for a long time, and you hear year after year after year that all these cuts in Medicare, Medicaid, that it's going to be gradually difficult to find a doctor that will take Medicare. But the truth is, I believe that most doctors in our area, anyway, continue to take Medicare, and of course all the hospitals do, and it's probably one of the staples of their practice, the Medicare.
Well, and that's a decision that's made on the physician makes.
Right, that's
not,
true.
Not necessarily an act or a
That's
program.
true.
They decide who they're willing to take.
Exactly.
So that's really not attributed to the act itself. Right here before we go then, if there's one main thing you think people really need to know about the Affordable Care Act's effect on seniors.
Well, it's not going to affect them negatively in terms of their Medicare coverage. If anything, it will be positive because it will help to close that donut hole, which a senior citizen will be very familiar with if they've got a Medicare Part D plan. And in terms of the health screenings, will be positive because there'll be some free health screenings now that they can take advantage of. So it's not going to affect them negatively. They don't need to go sign up in these exchanges that they've heard about. They are going to continue to be covered, and nothing should change with their plan.
Sounds like great news to me. Thank you very much. Appreciate your expertise.